All right. Okay, we are going again. All
Yes,
right.
yes.
Linda's going to do the invocation again.
I haven't done it yet. We haven't started really.
Well, you
Okay.
said I was.
Okay. It's bless our friendship today and bless this meeting. As we meet here today as members of Rotary, we pray that we are ever mindful of opportunities to render our services to fellow citizens and to our community. Let's continue to strive to make a better world. Amen.
Yeah. I don't show that it's recording, but
It's not. He's recording.
okay.
Okay. Okay.
All right. If you'll join me in the pledge. I
Pledge
pledge allegiance
allegiance to
to
the
the
flag
flag
of
of
the
the
United
United
States
States
of
of America
America and
and
to
to
the
the
republic
republic
for
for which
which
it
it
stands,
stands, one
one nation,
nation under
under God,
God, indivisible,
indivisible, with
with
liberty
liberty and
and
justice
justice
for
for
all.
all.
Okay, I've got a couple of announcements. Uh, on the 14th is our roundtable. It's our district meeting. On the 21st is our district assembly, and this is where all our club officers go to get trained. And it's going to be at the McKinney Higher Education Center. And then on the 28th is our polio gala. I think I got 6 or 7 silent auction items from different vendors this weekend. So I've given that to the chair. So that will take care of our obligations for the district. And they probably make more money that way instead of us being there. So, and that's all the announcements I have. Howard, oh, and then next week we will not have a meeting. It'll be a social at Lisa's house. And I guess most of you have heard now that uh, Howard is going to be moving, not leaving us, but just moving to the other side of the country, to Florida. So we're going to have a little get together and see him off in person. So, but come join us next Tuesday at Lisa's at 6 o'clock. We're going to have hors d'oeuvres. We're not going to have a regular dinner, but we will have heavy hors d'oeuvres. And Charlotte said will be wine. So come see us then. And
And everything Linda says we're going to have, she says I'm going to bring.
that's right. David's going to make it. So,
So,
well, that's important.
yeah,
Hold your house and no place to
I
go.
thought you would have a
Well, that's good. And so anyway, David's going to be making guacamole. We're going to have a shrimp cocktail, vegetable tray, uh,
I may do some
little sandwich
surprises.
cookies, and our sandwiches and all of that. So I think we will have enough to eat, but we're not going to have all the barbecue and everything else that we normally have. So anyway, uh, Howard, would you like to introduce or do you want me to introduce our speaker? Well,
We've seen him in person.
yeah. Well, he has a really unique, I guess, life that he's led. He survived. He's almost died, and he has survived. And I'm going to let him do all the introduction, if that's okay with you, Kuldip. It's
Sure.
and I can't pronounce your last name.
I remind people it took me 5 years to figure out my own name. So,
Okay.
and every time I'm with a group of people from India, they correct me all the time saying that's not how you pronounce it.
Oh, okay.
I pronounce it Kuldip, very Americanized. But the Indian, they put more emphasis on the second half of the name. So they'll say Kuldeep.
Oh, okay. And
Yeah.
then your last name.
It's Alaluya.
Okay.
It's Alawalia.
Okay.
But again, I simplify it for everyone.
Okay. Well, thank you for being here, and we look forward to hearing your presentation.
You're welcome. Well, thank you for having me talk at this meeting. As you sort of alluded very quickly, this is really about my journey and about a journey about someone who was pretty much on top of his game gets knocked out, and then realizes that everything he has learned about the medical establishment, about survival, and about teamwork can come to play in a very different sense, number one. But number two, there are lessons to be learned that can be taught to other people. So at the end of my journey, and it's been 7 years since the episode started, just to give you a quick background about myself. My dad was a diplomat. I grew up all over the world. I worked in corporate America. I worked with companies like General Electric, Toshiba. I've done 4 startups. Really did well in the corporate market. And then 7 years ago, I got diagnosed with leukemia. And being in the healthcare sector, and at one time I wanted to become a doctor, so I did go, took quite a few classes in medicine. I know a lot about oncology and all. I thought so I had it, I knew the nuances of hospital stay and being a patient. But what came in front of me knocked me off my keister in a big, big way. So I'm going to sort of talk about a little bit about my journey and talk about the takeaways, because those takeaways actually saved my life. The only reason I'm over here is because the lessons I learned and the team I built to help me guide through my whole journey. So I have a few slides I made up, and then we'll share those slides as we sort of go along. So at the end of it, and I'm sort of talking about the end up front, because of the people who came to help me, they told me that with the lessons I've learned to survive and overcome the odds, I should really start helping other patients because they're lessons which are very unique. No one talks about them, but they're lessons that everyone should learn and should literally live by to survive in this day and age. So a quick recap about my story. 2014, I got diagnosed with leukemia. So I had MDS AML leukemia, which means it gets progressively worse with time, which is actually worse than just getting AML leukemia. So based on the genetic predisposition of my leukemia, I literally had about a 10% chance of survival. They wanted to go into chemotherapy very quickly, saying that because it kept on changing rapidly, it was going to be more and more difficult for me to survive. So we started the chemotherapy. Typically with chemotherapy, with this kind of leukemia, they give you really aggressive chemotherapy. They literally wipe out your bone marrow. And after 21 days, the bone marrow comes back up. Hopefully the cancer cells are gone. In my case, my bone marrow collapsed. And now I was living on transfusions and antibiotics. So number one, we found out problem number one. And that is I'm allergic to 60% of the antibiotics out there. Number two, after 28 days, we waited for the blood count to go up. Did not go up. 1 month later, 2 months later, 3 months later, it wasn't going up. In other words, I became the bubble boy. I was confined in a 10 by 10 room. They could not release me because I had no immunity. My body wasn't producing any red blood cells, white blood cells, or platelets. So I was basically confined in a hospital. After about 3 visits to what they call critical care, and visits by the chaplain in the middle of the night saying, who's your next of kin, who can we pray for, and everything else, I decided it's time for me to sort of chart my own way. I was going to die in the hospital. So I literally drove out of the hospital in that condition, went to Stanford, and I started looking for doctors who could do something about it. Because I was in a different hospital, big hospital, but they basically did chemotherapy and said, there's nothing else we can do for you right now. Finally met a doctor who was fairly new over there, and she said, we'll try a bone marrow transplant. It's not that uncommon, except there were a couple of things against me. Number one, I was getting to the age, which was like 60, at which bone marrow transplants don't work that well. A bigger problem was there was no match for me in the world. So,
what blood type?
So it's not a blood type, it's a tissue type.
Oh, okay.
And it's much more complicated. And for some reason, there is about a 40 to 50% chance you're going to find a match. In my case, we weren't able to find a match. And then on top of that, because my bone marrow had pretty much collapsed, my body wasn't producing anything. They had never done a bone marrow transplant at my age with that condition. So even if they did, they sort of said the chances of you making it is really rough. Fast forward, I've got 2 siblings. We tried their tissue. One is in Switzerland. He flew over here, no match. My sister's in Canada, no match. So we ended up deciding to try, at that time, an experimental procedure where it's 50% match. It doesn't work most of the time, and even if it works, you only get 3 to 4 months to live. So it's basically buying time for the next thing. We went forward with that transplant. Surprisingly, I did well. They weren't expecting me to make it. In fact, the doctor had given me less than 1% to survive. I had to sign all kinds of disclaimers up front because they'd never done a procedure like that. Did the transplant. I recovered, and I was perfectly fine for about a year. Instead of 4 to 5 months, I had a year. Then I had another relapse. Again, the same problem. But before we go too far, by this time the insurance company came back and said, we've already spent $7 million on your treatment. The chemotherapy we gave you nearly killed you with the bone marrow because your bone marrow collapsed. The second go around, we have to use treatment, which may be about 20 times more toxic. And they would not recommend doing that. So at that time, the doctor who did my bone marrow transplant, she basically said, you know what, we will try it. Obviously, I had to sign waivers again to say it's a high risk thing, but we'll try to do it. We went through the chemotherapy, despite the fact that the insurance company didn't pay for it upfront. I did well, and then again, we did not have any match for a transplant. So this time we ended up going for cord bloods. So typically with cord blood transplants, they need enough blood from 2 cords. In my case, I'm such a unique case. We couldn't find a single donor with 2 cords for my transplant. So we ended up finding one in Louisiana and one in Singapore, except the one in Singapore was the donor was infected with Hep C. So again, we had to navigate through everything in terms of how to treat the cord cells before they put them into me, before I got the transplant, and hopefully I lived. And surprise, surprise, I'm here, today. So I'm an anomaly in a lot of ways. What was fascinating about the whole process was, thanks to my doctor, is that she would listen to me. So because the treatment regimen is really toxic. And so typically what will happen is they do the chemotherapy for the bone marrow, with the chemotherapy. You recover from that. They give you about 30 days to recover. Then they do another round of chemotherapy and radiation therapy. They again try to kill you, literally, before they do the transplant. And after the transplant, there is a 110-day recovery period where you're in isolation. In the old days, they used to put you in the hospital. Now they put you in isolation. And for patients like me, with my predisposition, about 90% of us die within 1 year of the diagnosis. But a lot of us die during the chemotherapy or the bone marrow transplant, and the other 90% of us die within 1 year of the transplant or the bone marrow, or the chemotherapy. It's very toxic, a lot of side effects and all. But during the whole process, I was able to talk to my physician, and she was able to help me change the regimen of my medications to a point where in the second go around, I did not throw up even once, despite the fact that they were giving me really aggressive chemotherapy and drugs. I refused to take a lot of drugs that supposed to calm you down and keep you sedated. But I would give feedback to my doctors. I could tell them 2 days before that, I'm feeling my heart rate going up, and sure enough, 2 days later, they'll find the enzymes in my blood. I would tell them I'm having trouble passing water in through my bladder, and they'll find kidney stones or other infections and all 2 days later. But because of that, we were able to modulate my medications all along. as a result, not only did it survive, but I'm the only patient that my doctor knows of who's not taking a single medication.
Currently,
7
you're
years
not-
after diagnosis. Not only have I survived, but I'm not on a single medication 7 years later.
Mm.
Not for heart, not for liver, not for kidneys, nothing.
You're a rebel.
But, you know, again, I learned something very quickly. And that is, there are keys for survival, because I ended up, the good thing is about being in the hospital for 5+ years, you talk to a lot of patients. Unfortunately, in my group, I'm the only survivor left, you know, who were active, going to the hospital and all, but I talked to a lot of the families. And we started benchmarking, you know, there were a couple of survivors that I've sort of networked with in the Leukemia Society and then other cancers. There are a couple of takeaways which we all have in common. Number one, we basically built a team, or we have a team, the doctor, the specialist, and in a lot of cases, the caregiver, who are really, really, really patient-centered. And I'll give you an example. Typically what happens is, and that's exactly what happened to me. The first time I went to the doctor, my GP, really great GP, he said, let me call a specialist. The minute I walked into the hospital, locally in the East Bay, the doctor looked at me and said, I know what's wrong with you, and we're going to start chemotherapy right away. And I said, before you start chemotherapy, don't you want to know what exactly the, you know, the makeup of the cancer is, of the leukemia is? She said, I'm so sure about it. I said, no. I walked out of the hospital. I had to sign a release saying that I'm walking away from the hospital and they may not treat me. But that gave them a chance to, number one, find out what it was. It was actually worse than what she had thought. But it also gave me a chance to sort of start making phone calls to who's who in the world. So I started talking to people at Fred Hutch, which is in Seattle, Sloan Kettering in New York, with the top AML doctors to say, what are the new treatments? How would you treat, and everything else? And all those conversations came to play over the next 5 to 7 years when I didn't have a match, you know, how to do the transplant, how to manage and all. So luckily, I built a really good primary team of physician and all from the get-go. And then the lady who did my bone marrow transplant at Stanford, she was a godsend. You know, she listened to me. She put together a team. In the second go around, she chose the oncologist to treat me and all. So every step of the way, we became very close. And she was basically my guardian angel in a way, monitoring every step of my treatment and recovery. The second thing I learned very quickly is you really have to educate yourself and ask questions. I know most patients literally feel, and I felt the same way, I'm going to a great institution, you know, whether it's MD Anderson or Mayo Clinic or Stanford, anyone else, the doctors are experts. The doctors only know what they know. And depending on what doctor you go to, 90% of the time, they only treat the symptoms. They don't look at the underlying problem. And they do not even look at what medications you're taking that may have caused a side effect or a problem. So for example, just before I got diagnosed with leukemia, so my presentation of leukemia was unique. Typically you have, you know, your red blood cells are decreased, so you have trouble breathing and walking and all. I was perfectly normal. I could walk 2 to 3 miles a day. The only clinical indication I had was my platelet count was virtually 0. Hard to tell unless you have a bleed. Then you can die of hemorrhage. But after talking to some specialists at Fred Hutch and all, they said, you know, that can also be caused by Advil, by ibuprofen. And I'd just gone over and taken a really high dose of, Advil. So we had to rule that out. But little things like that. So the presenting problem may be very different from the actual problem. And the more I was in a hospital and the more I watched, not just myself, but other patients, they would come back and they would say, you know, we're having this problem. They give them the next drug. And guess what happens? They have a side effect from that. And just to sort of talk about what happened to me in the last 12 months. So this is after my recovery and everything else. last year I had shingles, very common for cancer survivors. Went to the doctor, they gave me a drug which is very commonly given to shingle patients, nortriptyline. Within about 3 days, I'm calling my doctor and saying, my GP, and saying, you know, I feel funny, I don't feel right, and it's by the medication he started giving me. And he said there's nothing wrong with it. He had me come to the office, nothing wrong. A week later, I'm calling him again every day, sending him emails and saying there's something seriously wrong with me, and check. So, and I go to the hospital, they say, oh, you know, you have a cardiac problem, your blood pressure is really high and all, you know, it's a different problem. I said, no. You started nortriptyline a week ago and it's caused by that. So I went back to my bone marrow specialist, and she knows me really well. And she said, no, if you're telling me it started when you started taking the medication, I'm going to take you off. A week later, I'm back to normal. And then something very similar to this happened just about 3 months ago, where they put me on a really ultra low dose of medication, and you know, my blood pressure, and I was getting pulmonary edema. I called the doctors. They said, no, it's not indicated with this medication. And sure enough, they took me off within a week, perfectly normal. So those are some of the things that I'm talking about in terms of educating yourself and asking the right questions. And I'll tell you another story. I have a friend, his mother just passed away. She was an elderly lady. She was in an elderly care facility. His sister used to pick her up, drive her to the hospital to see a doctor once a quarter. When she passed away, my friend went over to sort of close up the affairs. He found out there she was on 15 different medications. So every time she'd go to the doctor would say, okay, what are your symptoms? What are you complaining about? Here's the medication. Half the medications were contraindicated for what she was taking. But that's very, very common. So again, the idea is educate yourself, ask questions. If you're not capable, you need to have a caregiver who does that for you. And to me, that was really important. The last thing was, I was really cognizant of my body. It's not a special trait, because I know a lot of people, they in a way put a filter in front of themselves saying, I'm in hospital, I'm going to let the doctors or the medical institution monitor me and give me the medication. I took the opposite approach, where I would listen to my body and I would provide feedback to the caregiver. Every time they would say, take this sedation, take this or that, I would actually question them, not being derogatory or anything else, but to say, why am I taking this? Let's do a review of everything I'm taking. Was it caused by something else? As a result, I was taking about half the medication of what the other patients were getting. And also many of the toxic regimens they give you, post-intervention. My doctor basically said, you don't need it if you're feeling well and all. As a result, because some of the medications, if you take them for 7 to 8 days, they'll affect your heart, your kidneys, your liver, and everything else. They're really toxic medications. But I was able to cut back the dosage from the normal dose in a big, big way. And the last thing I did was, very consciously, I would rather be in a little bit of pain than give the alternate, and that is, whatever you want in a hospital. You can get morphine, you can get Tylenol. Literally, they start by saying, okay, you want to start over here with Tylenol? Do you want something stronger? All the way to morphine within about 20 minutes. They just want to put the patient to bed. And I would sort of say, no, I would rather be aware, I'd rather be in pain. I want to tell you where it's affecting me and all. So that, combined with my doctor, who was really active in my well-being, helped me be in the stage where I am today. Active, fully functional, and sitting over here trying to tell my story over here. So one of the things I learned very quickly, despite the fact that I was in the best of hands in terms of healthcare. When you look at healthcare, it used to be, you went to see a doctor somewhere, you went to a lab or a hospital, for diagnostics, and then you went to a hospital for treatment, and they kept you till you recovered and then sent you home. Nowadays, just because the healthcare costs, the hospitals are trying to reduce the healthcare burden, they're sending you to outpatient recovery. So in my case, the treatment period was 35 days. Toxic chemotherapy, your bone marrow is basically collapsing, it's slowly coming back. When it barely comes up, they send you home. Most patients could not cope with that. As I mentioned, the fatality is really high. Among the group of patients with similar disease like me, 90% of us did not make it during that process. And when I talked to the caregivers, the surviving caregivers, it was shocking. They said they had no idea what they walked into. We were given 2 sheets of paper on how to manage our recovery, and the recovery was 110 days. And by the way, if we took the wrong foods, if we ate them in wrong sequence, would have severe side effects. But they don't tell you anything like that. You know, as I mentioned, I was cognizant. I went through it 2 times and all. The little mask you see me wearing over here in the picture, I had to wear it for 110 days. You know, so every time I left the room, I had to wear that mask. Even inside the room, and this is in solitary confinement, I had to make sure all the windows were shut, double ventilation, HEPA filters, and everything else. Any food I ate had to be freshly cooked. Within about 40 minutes of it being cooked, you had to eat it. So a lot of restrictions to help a safe recovery, but we don't have the mechanism to do that. Again, it goes back to the caregivers. And then reality, everything is moving towards outpatient. In fact, I help out some elderly couples over here, and I got a phone call while I was in the hospital where there was an 80-year-old lady, she had a valve transplant in her heart. It was leaking. They took her into the hospital. The husband called me up and said, you know, they're just going to keep her 1 day in the hospital, monitor her and send her back home. And he said, I'm 80, I don't have a cell phone. How am I going to watch her or take care of her? But that's a reality becoming more and more. You know, I had real toxic chemotherapy and everything else. A lot of insurance companies send you home. And I saw patients after the chemotherapy, they were literally put in a stretcher and taken home because the insurance would cover it. So it's a reality. And one of the things that no one is doing is actually looking at the patient and the caregiver to say, how can we help them? So one of the things that I've, at the urging of my doctors, say, you know, let's start looking at how to help the patient and the caregivers once they leave the hospitals in a big, big way. And I know this is old data, but AARP had come out with a report about 7 years ago now. And they talked about a statistic which floored me completely. They mentioned about 40 million people were caregivers in some capacity right now in the US. But the number, the cost it was for the caregivers was staggering. 470 billion, which is great, which was greater than Medicare at that time. And the number's only higher right now because a lot of people don't even count the hours and the time they spend taking care of the parents or children and everything else. But it's staggering. So that's a new reality, but very few people talk about it. I was lucky to have a team where between the doctor and my caregiver and all, we were able to intervene very quickly and guide me through the whole process. And then the last part is, you know, I want to get back to deliberate practice because one of the things is we have to educate the patients and the caregivers. There's one universal truth about what we are facing. Everyone has been a patient, they are a patient, or will be a patient in the future. So we might as well learn up front how to be cognizant about the treatments that we all have to go through at one time or another. You know, we have to practice it in a way. And we start practicing it with our GPs, asking the right questions, watching our bodies, providing feedback and all to our doctors so that we're better prepared going forward. So one of the things that we've come out with within our group is, you know, what does it mean? It's how can we teach people, patients and caregivers, and this is like, it's like practice, just like you're playing baseball or hockey or anything else, or football, you practice the skill over and over again, that you have to become an expert in coming up in your own body, to be able to watch what the symptoms are, what are the side effects, what's normal and what's not abnormal for you, but also report any toxicity or failure to achieve clinical effect. In other words, you take a medication, you're not getting relief, report it. Most of us don't say anything. We just go back to the doctor and say, I'm having this problem, and they'll give you another medication without saying, oh, you were still taking this medication, we're giving you another medication. It's happened to me over and over and over again. So it's very common. Number two is we have to become active in our health and be really clear what happens. One of the things that helped me was there were critical points in my treatment where I had anecdotal information about, oh, if you do this, your kidneys can be damaged. So for example, with CT scans, which are very common nowadays, I knew in our family, every time they did a CT scan with contrast, your kidneys are affected. So after 2 CT scans with contrast, I told the doctors to measure my kidney function. And sure enough, they found that every time they did a CT scan with contrast, they're affected by 10%. So after 2 of these episodes over 5 years, we basically said, no more no more CT scans with contrast. You can do CT scans without contrast or do an MRI or ultrasound. So those were some of the critical things that helped me get over here.
So what is your diagnosis now? Are you in remission? Are you cured? Or it can come back?
So technically I'm in remission,
Okay.
in the classic way, but leukemias are a little different in the sense that when they do the chemotherapy, they basically try to clean up all the cells in the bone marrow. So liquid tumors, which leukemia is different from solid tumors, which may be in the chest, lungs, and all, which tend to migrate all over. With leukemia, it's basically the functioning of the blood producing cells. So if they've moved too fast, you're not producing enough red blood cells, white blood cells, and all, and you die because of that, rather than you get metastases all over the body. So I'm in remission technically, but because I have genetic mutation, 2 of them, they can always come back, number one. But number 2, as I mentioned, one of the rare things about my condition is they mutate. So if they mutate again, then I don't have any more chances in life, because they can only do 2 bone marrow transplants 2 times. They cannot do it the third time.
I always say third time's a charm. You might.
Apparently, the bone marrow, it just cannot. The bone marrow becomes too elastic, so they can't do a third transplant. I don't think that there's a survivor. I'm sort of unique in the sense I have 3 transplants in me, but no one has sort of survived 3 transplants and lived for too long.
So we'll keep on.
Well, thank you.
Well, we look forward to. Oh, okay. You've got some more.
Yeah, basically, I just have some, things over there in terms of, everyone needs it. So basically, I'm on a mission now, or man on a mission to educate other patients and help them. I talk to leukemia patients all over the world now, where they reach out to me and ask for help in what's going on, guide them. They have medications they don't understand. I help the families out.
Well, I really like where you're talking about, you know better than anybody what effect that treatment is having on your body. And if you can recognize what's going on, like you said, I'm taking 3 blood pressure pills. 2 of them are to counteract the side effects of the first.
Mm-hmm.
So, and I wonder if that's not, well, part of being tired all the times. I'm old, but part of it may be that the drugs are dragging me down.
Well, he's taken one for cholesterol.
Yeah,
Then
but
he's taken one for high blood pressure, but then he has to take another one that,
two more.
well, one of them is a vitamin, potassium, and then the other one is a diuretic because the one of them counteracts the other. So you have to have the diuretic. I guess the high blood pressure, you retain fluid, so you have to have the diuretic to
Right.
release fluid. And then he has a vitamin. So he takes 4 or 5,
Four
4,
plus a one-a-day generic and
yeah.
then
So,
So there's a doctor, Florence Comite. She's from Yale University, and she's written a book about personalized medicine. And she talks about, we normally follow protocols, what we call standard protocols. And we give medications based on standard protocols. We call people who got high blood pressure, the cholesterol level is high and all. But she makes an argument that everyone's blood pressure, cholesterol level is different for different people. And she's sort of going away from the concept about if you hit a number, you put them on medication and all, because just like in your case, typically people get one medication, their side effects, they have to give another medication, and every medication has a side effect.
Right.
And toxic effects. Even Tylenol. You
Yeah.
take Tylenol extended period of time, your liver is going to be affected.
yeah, side effects are worse than the actual disease.
Mm-hmm.
yeah,
No, so the second thing that happened to me in October, November last year, my GP started said, your blood pressure is on the high level. It's not high. It's still on the border, but because my body has taken so much abuse, why don't they put me on a really small pill, Linspro, which is very, very common. And he said, I'm just going to start you on 0.5 milligram. The normal dose is about 10 milligram. He said, just so that your body gets adjusted. Within a week, every time I would lie down, I was coughing. Obviously when you call, your GP is not there. So I show up over there. The hospital said, I'm coughing and all. And I said, I think I got pulmonary edema. And they said, oh, you got pulmonary edema. We have to do this intervention, this intervention, this intervention. I said, no, let's back off. This started when I started taking the medication on this date. And I called 3 days later saying, I'm coughing. So sure enough, my GP comes in and he said, how the hell did you know you had pulmonary edema? I said, when you lie down, there's something funny going on. And he was totally astounded. He said, you know what? You're absolutely right. Let's take you off the medication and monitor you for 3 days. Went away. So, but otherwise it would have been, they would have given me another medication to control the thing or do a bypass or something like that. You never know.
Okay, so when do you think you can come back on?
You tell me, and then the second thing is, this is much more about me and what I was able to do. So one of the things, I should make a shameless plug while I have you guys over here and you're going to put it on YouTube. One of the things I'm trying to do with my foundation is to help other patients, but I also want to build tools to help patients and caregivers, because I came across technologies that people say are going to help the patient or the caregiver, but they're all geared towards helping the institutions for billing, insurance purposes, and or for collecting data so that they can sell to pharma companies. They weren't really geared to helping the patients or the caregivers. So again, talking to my doctors at Stanford and Kaiser and people at Mayo Clinic and MD Anderson, they're saying we really need to start doing something for patients, which is geared for the patients, by the patients. So one of the things I want to do is really talk about that aspect, about some of the things we're trying to do, and see if we can get groundswell support to get people much more interested in joining, contributing, donating, time and all. But our goal is to help the patients and caregivers, because I can tell you, I'll need it.
We all need it. Well, Howard has an email address or a website that you can go in and register.
Mm-hmm.
If you want to come back in May,
Sure.
or like that, and he can set you up. I think Howard He wants to talk to you about other things also, but Howard can give you the information.
Maybe we can get,
Okay, do you see your chat box?
Yeah, it's up.
Okay.
Okay, great.
maybe we can even get Sonny to log on. Did you get a hold of him?
No.
No.
And I'm going to go ahead and put some of this on Facebook too, if you don't mind.
Please do.
What is the
That's-
chat?
So part of the story I did not talk about is in between. I got invited by Father Perry to come visit with Pope Francis for this 800th anniversary of the Franciscans and be a guest of the Vatican. I got a friend of mine. He arranged for the rabbi in Israel to do a prayer for me at the Wailing Wall. I got blessed by Kutanla, who is the head oracle of the Dalai Lama, before I went to the hospital the second time. So all these spiritual people came over to help me out and bless me and wish me well. So Noi Visium, Visium is vision and Noi is new. So it's a Germanic Latin name for it's a new vision for patient care.
Okay.
Because as I mentioned, everything in healthcare, they talk about being patient-centered and everything else. But when you're a patient and you sort of say, okay, I want to use this tool, I want to do this, and you find out nothing helps the patient, everything is geared for the hospital and insurance companies. Nothing is designed over there to help the patient. And so basically, as I mentioned, my doctor who basically helped me tremendously, she just sort of had one wish for me saying that, go help other patients. She said, I believe that you have the capability to help other patients build something and all. So we started the foundation. It's a 501c3 nonprofit. And our goal is very, we're pretty ambitious in one way. I want it to be a ground effect. In other words, I want the patients, caregivers to be part of it. We want them to sign up, tell us what they want, and let us build tools. Obviously, I benchmarked myself, and then I'm also talking to other survivors in cancer, different kinds of cancers, to say what was their journey like, what kind of products they would like to see, what the caregivers would like to see. Because when they go back to the hospital, they'll need these tools.
Okay.
So the idea is to raise money, obviously educate, teach patients how to sort of be aware of everything else. I'd like to do a book, and Howard, I'm going to talk to you about it, about my story, because there are wonderful elements of my story between my doctor and myself, in terms of how we were able to overcome a lot of odds, and how she took control of my situation, and that's one of the reasons I'm alive. And eventually, I want to change the way we're doing research. So I'm working with Mayo Clinic, one of the chairs for neurosurgery at MD Anderson and all, to actually see if you can't change the direction of research and start looking at research and making progress in patient lifetime. So rather than putting the goals 10 years, 20 years, 30 years down the road, we want to see progress in 5 years or 10 years from patient to patient. So it's a new concept, and I'm getting people really excited about it. But again, we need support in a big way.
Howard, do you want to lead us in the four-way test? Is it fair, concern? And thank you, Philip, for coming. And we look forward
Welcome.
to
Thank you.
seeing you again. And this is it. Thank you. See you next week.
Okay.
Good.
Bye-bye.
And Howard, I'm going to send you an email. Okay. Okay. Bye-bye.